Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin.
Mm-hmm.
He's board-certified plastic and reconstructive surgeon.
Yep.
Dr. Martin, how you doing?
I'm doing really good, Amy. Thank you.
Good. Well, this is a fun episode. Before I jump into it, we are going to show all of our social media handles here. You can also leave us a voicemail or send me a text at 303-630-9038. I actually have a bunch of listener questions. I feel like every time we release a questions from listeners episode, we get tons more.
Yeah.
So if you've asked a question since the last Q&A, they're coming. Like, we just had some other things come up first. So
in the operating room today, one of the people we were working with said, Dr. Martin has a podcast. And the anesthesiologist said, really, you have a podcast? She goes, do you have a good listener base? I'm like, you can't imagine how many questions we get.
Yeah.
So we love the questions. I mean, we could do listener questions every episode, probably.
We do get a lot.
Yeah.
So, well, they come in spurts. But either way, that's not what this episode is about. This episode is, we're diving back into pedantic Reddit.
Not weird Reddit?
If you know, you know. Not weird.
Okay.
We're trying to keep Dr. Martin off of weird Reddit.
Yeah, I've never been on weird Reddit. I just referred to it as weird Reddit. And you guys told me I'm not really on weird Reddit.
No, you're not. Even when I was researching for this episode, Catherine and I were chatting about it. She's like, oh, yeah. She's like, I love Reddit. She's like, but it gets weird. I'm like,
gets real weird.
Sure does. So Reddit is an interesting place, especially when you are, searching for something like plastic surgery. So I thought, like, what would be an interesting topic to look at Reddit for? And liposuction is one of those things I think is very misunderstood.
Yeah.
So I thought, what would people want to know before having liposuction?
And the Tummy Tuck kind of had some of that quality too when we've done an episode from Reddit on their responses.
Well, I think that's any surgery, but specifically lipo, I feel like just it's very misunderstood.
Totally.
In its recovery, in its everything. So that's why I trolled Reddit and found a bunch of comments, and I have them in kind of groups of like types of comments, and I'll just read them and then you and I can chat about them.
Is one of the groups weird, crazy, and uncomfortable?
No.
Okay.
No. So the first category I called prepare in advance. So this is like the biggest thing is what you should have on hand before having liposuction. And like I said, I'm going to read these and then you and I can kind of chat about them. So number one, get your pain pills before you have your surgery.
Preach.
You won't want to wait afterward. Doctor, how many times does a patient not pick up their medications for surgery?
My God.
It is the most annoying thing to me.
And then we get the recovery room nurses who are all wonderful and well-intended, but they're like, well, you didn't give them their medication. And I'm like, oh, we did.
Yep.
We didn't go pick it up for them, but we gave them the prescription. How do you know that? Because we do it digitally.
Yeah.
Literally.
I can actually see when it was faxed.
It's not even a piece of paper anymore. Yeah.
No, it can't be. And I can actually see that the pharmacy received it as well. So it's not
crazy.
Yeah, we can see it all. So that's definitely get your prescriptions filled before surgery. Number two was a female urinal, which that one I think for lipo, I wouldn't recommend that one. Absorbable pads, adult overnight diapers, hydrogen peroxide spray.
The diapers may be for leaking from the lipo.
That's what they meant for leaking. You will stain sheets and towels. It's unavoidable. No or minimal prep food, snacks, and a second set of compression garments. So definitely don't put hydrogen peroxide on your body. So they were talking specifically about using it to get stains out of sheets and stuff.
Okay.
Yeah. So like no hydrogen peroxide on a healing area. It's like the worst thing ever.
Is that still a thing? Because I had someone ask me recently, like, oh, shouldn't I put hydrogen peroxide on this? And I'm like, if you don't want it to heal, then you should, because it's devastating.
Was that a thing when you guys were kids? Because it definitely was when I was a kid.
Well, it cleans a dirty wound, like a road rash.
Even the school nurse would like put hydrogen peroxide
on everything.
Yeah.
Well, yeah, if it's dirty, if it's a dirty wound, yes.
No, yeah, I get it.
There's a difference between cleaning dirt out of road rash with hydrogen peroxide versus putting it on a clean wound that you're trying to heal.
Which is not good.
No.
Gotcha.
It debrides
do you remember the spray they used to do that was, I think
it was called Bactine.
Bactine, yes,
which is like
absolutely.
It burned like crazy.
Yeah,
it
be
burned.
like,
like scream.
Or just straight up idea, where they take the big swab and get that
iodine,
big old thing of, glob of iodine. It's like, brownish yellow, and then put it on your wound. You just have that on your face at
Those
school.
are the good old days when there wasn't liability and they could do whatever they wanted to.
Totally. I think I'm old enough where they would actually give you aspirin at the nurse. I think that stopped when I got in middle school.
Yeah.
Yeah, so definitely I agree with all these things except the female urinal. I mean, with lipo, yeah, it might hurt to sit down to pee if you had lipo on your inner thighs, but if you have
Or
lipo
the
on
saddlebags too. I mean, yeah.
inner thighs, it's really the inner thighs that
Okay.
hurts. It's not the outer thighs.
Okay.
It's the inner thighs that hurt when
Yeah.
you sit.
And I guess you
Surprisingly
could always
enough.
hover over the toilet too.
Yeah. And I mean, if you're having lipo on other parts of your body, though, the female urinal is not going to be helpful at
Mhm.
all. But definitely stuff to absorb leakage. What it might have been the episode about tummy tuck myths or tummy tucks where the woman said it was like squeezing a juice box. The lipo. Yeah. So
I
you'll
do
leak.
remember that.
You're going
And
to
then
leak a
we
lot.
talked about Capri Sun.
Yeah.
Really going throwback today.
Yep. So definitely. And a second set of garments, when we order garments for patients, we always order two because yes, the first night you're going to leak right through it. It's going to be soaking wet the next day. So you want to have one to change it
So
to.
how hard is it to wash these garments? I've never even asked that
It's
question.
not. You just wash
Okay.
them in the washing machine, just like normal.
And then
it's
air
like,
dry them?
Yep.
Okay.
So this person was kind of following up that they definitely recommended the urinal. And I guess that's just not something we recommend for lipo specifically. Many puppy pads, which are the absorbable pads, period underwear, like diapers, and these people are just like leaking everywhere. Baby wipes, pillows, a neck pillow, a body pillow, all the pillows. Because laying on your stomach, this person had a BBL with her lipo requires creativity to be comfortable. A few cheap blankets, so you don't stain sheets, lots of drainage, murder scene level. That's normal.
That's true.
Bandages, gauze, protein shakes, very baggy clothes that you don't mind staining. She also bought these at Goodwill, electrolyte powder packets, and then Tylenol. She said ibuprofen and Tylenol, but follow your doctor's instructions.
Yeah, no,
Tylenol for sure.
yeah.
Yeah, these are all great. And these are all things we recommend. I love electrolyte powder. I love making sure people keep their protein up after surgery. The pillow system is awesome. If you're staying not at your own house after surgery, especially after lipo, if you're staying at a hotel or at like a friend's house, oh yeah, lots of protective layers underneath you so you
Maybe
don't
a
ruin their
shower
sheets.
curtain, honestly.
Yeah.
Yeah.
Yep, just to make
not
this whole
joking.
murder scene sound
Like
even.
Dexter.
Yeah,
Yeah.
because you're gonna leak, and it's normal. Like she said, it's normal.
But it's only for 12 hours, 24 hours. So
Yeah, it's the first night.
yeah, the second night you're not going to really be leaking. So it's just for a short period of time.
Some people do leak the second night just because of positioning for so long, but like, it's nothing like the first night.
And by the way, the leakage is the tumescent fluid we put in, which is how we numb you up if you're doing it awake or even make it feel better when you're asleep. Also has epinephrine in it that helps with control bleeding. So that fluid that we put in is absolutely necessary for liposuction.
Yeah. And I always tell people the more that leaks out, the less your body has to absorb. So leaking is fine. And some people don't leak at all. And that's also fine. Like that's not bad either. So
You skipped over the only thing I wish I knew is how hard it would be to poop. Or that was I'm sorry, I was reading ahead. Apologize.
yeah, I'm like, I don't know what you're
I
reading.
was like, that just caught my eye.
Yeah. So
The pooping
see,
part.
no.
You're like a pooping expert. We've established this before.
Yes. So this one is kind of long, but it hits on so many of the things that you and I have talked about on so many of our episodes before. So this person said, I feel like as I read this, I'm like, oh my gosh, did she listen to our podcast? I set up a little fold out table with my pain medication, antibiotics, hand sanitizer, and other
Recovery station
essentials.
meals.
So it would be easier to access. Get at least 2 compression garments because they get nasty quickly and you'll want to wash one while wearing the other. I also deep cleaned one of my bathrooms in my place to make sure it was prepared for post-surgery needs, drains, etc. It's such a good idea to clean everything in your house before surgery. Yes, because you don't want to clean it after. You're going to be sore. I also bought 3 comfortable, easy to pull on pajamas. I also recommend body wipes and dry shampoo. Yep, because you get that post-surgery grimy feeling. Depending on what you're doing, you may not be able to shower for a few days. True. Prepare all of your favorite snacks, Gatorade, healthy foods. Have a small trash can ready because you might throw up the first 2 days. I also felt very prepared the second time. She had a BBL the second time. And the only thing I wish I knew was how hard it would be to poop. TMI, but it sucked. And how miserable sleeping on my stomach would be.
Yeah.
People, no matter how we make people sleep, they hate it. Also, get some new cheap bed sheets and wash them. Yes, wash them prior to surgery.
Yeah.
There are people who just take sheets right out of the package and put them on their bed. Like, no. Yeah, so
Oh,
why is it hard to poop
there's
after
people in my
BBL?
house. I'm not going to throw them under the bus that do that. And it is disturbing. I'm like,
Yeah, how do you stand the formaldehyde smell? Would drive me
Oh,
nuts.
my skin would, I'd be in a,
Yeah, like
one
no,
big
we had a
rash.
conversation. We had a slight disagreement. I was like, no, nothing goes on my bed till it's washed.
Yeah, no. So, Dr. Martin, why specifically is it hard to poop after a BBL?
There's many different things, but the main issue, one of the main issues is opioids or the pain medication.
Or not being able to sit.
Well, that's true too. Yeah. So the first, for any surgery, the opioids slow your gut down, and constipation is really common with pain medications. One of the reasons we don't like to use pain medications because people get so constipated. Again, Amy is a poop expert, literally.
Yeah.
I feel like she's a savant. She should have a journal just called Poop. Because she's that good at like figuring out how to make people poop. What is the smooth move? That's your favorite thing.
Smooth move is good.
Yeah.
Yep. Well, it increases peristalsis, which is what opioids stop.
It counteracts the opioids. The second reason is, I mean, truly, especially when you're getting liposuction of your inner thighs, outer thighs, or in that area, even flanks, is it hurts to sit. It really does. It's super painful.
Well, specifically with BBL too.
Yeah.
That's more it. The inner thigh, you're fine sitting. Trust me. Once you're sitting with thigh lipo, you're fine. But sitting and putting pressure on your butt after a BBL is not something you want to be doing. So it's not like you want to be sitting there with your feet up on your squatty potty for extended periods of time, putting all this pressure on your buttocks because we've told you not to sit.
So if you've had a BBL, you can't put pressure on it. If you have lipo in that area, it hurts. And it's kind of a cluster.
Yeah.
It's difficult to get a position that actually works with the BBL or get a position after lipo of the outer thighs, the saddlebags it's not painful. And then it's hard to do your business at that point.
Yeah.
The BBL part of it, I mean, you could hover over most people don't have like the geriatric bars.
Right. Which would be helpful. And a toilet extender.
Actually, it would be.
Yeah. Yeah.
You could install those after a deep clean. Those geriatric bars that you put near the toilet.
Just keep them until you're old.
Yeah, you keep them there until you're done.
Yeah, but I think that the other great point she made, though, was about making sure your house is really clean prior to surgery, because you're going to be moving slow and like
you're just
depending
trying to qualify your obsessive behavior at your own home.
But depending on what kind of surgery you have, I actually had this conversation with a patient just this week who asked me when she could vacuum. And she had a pretty major surgery. I'm like, not yet. Yeah. I'm like, she's like, I'm kind of going stir crazy and cleaning really helps. I'm like, I get that, but vacuuming is not the thing. I'm like, nope. So.
And also it's good to call upon family members, friends to help you out too.
Right. Yeah. But you don't necessarily want to announce to the world that you had surgery. So if you can clean your house beforehand, you're going to feel better. The snacks, hydration, like awesome, like such great advice. So these ones were really good. This one I love. I wish I would have bought a footstool for getting into the hotel bed or just anything. She wrote, I'm short. So yes, I always recommend that people put stuff that they're going to need, at waist level. But if you're staying somewhere or if your bed is that high, crawling up in and out of a high surface is not.
If you're rolling up in a nice hotel with a footstool, what do they think's going on over there up in that room? I mean.
Footstool. If you're also only under 5 feet tall, I mean, I think they think you just travel with a footstool for just life. Yeah. You're going to change the light bulbs.
That's true. Yeah.
You're like,
oh, she needs the footstool.
Yeah. Yeah. This one, if you are in a recreational legal state / country, I highly recommend edibles they put ibuprofen, I would say Tylenol as you transition off the pain meds. It really takes the edge off pain while relaxing your muscles.
Yeah.
And I appreciate that she did put edibles because you definitely do not want to be smoking any substance at all after surgery.
So again, always follow your doctor's instructions, but Amy and I talk to our patients about ibuprofen, which can affect the platelets' ability to form clots. So it can actually increase your chance of bleeding after surgery if you take ibuprofen, which is why we don't recommend it within how many days after surgery?
I mean, I like people to wait at least 5 days. 5
to 7 days, yeah.
Depending on the type of surgery. Some doctors, though, and there are doctors who I've talked to who will do ibuprofen immediately post-op for even things like breast aug and other surgeries. Right. So, follow your doctor's instructions.
It's not wrong. And it's obviously not that much of a higher risk for bleeding, but it theoretically increases bleeding risk and bruising.
Yeah. And you definitely don't want to smoke after surgery. Again, any substance is going to, smoking anything, any inhalationals are going to really impede your body's ability to transport oxygen and to heal.
So Amy, what about these nicotine pouches that all these dudes are doing?
I'd be fine with that. It's not the nicotine. Nicotine is not what causes the issues. It's the same thing with edibles. It's not the marijuana that's causing the issue.
But nicotine is, I think we got to look this up, is a vasoconstrictor though.
It is a mild one. It's like, so is caffeine.
Yeah.
So,
like a facelift or something where you're worried about blood supply.
If someone was using them excessively, then it would be the same thing with like caffeine. I wouldn't want somebody like pounding energy drinks after surgery.
Right. For
that same reason, it's going to increase your heart rate. I mean, nicotine in those pouches is very microdosed, or in like the little mints or the dissolvables.
Apparently you get different dosages. I don't know anything about this world.
Yep.
Yeah.
Well,
there's
just like
low
with
and high doses. Yeah.
Yeah. I mean, I wouldn't want someone like yeah, like using like chewing tobacco and having it in all day long. Like that's gonna probably have a bigger, like just like a
Just
woman
trying to picture the woman like just got out of lipo
with her
a big
spit cup.
like a spittoon.
I'm from Kentucky, man.
I'm sure it happens.
You're speaking to my family right now.
Dr. Mars is like, that's not weird to me.
That's not weird at all.
But those little nicotine, they're meant for the nootropic effect. Like that's what they're dosed for. They're not dosed for the effect. Like they're dosed much
I
differently.
got that. Yeah, but chronic use of nicotine, just FYI, if it's in a pouch or a cigarette or a vape pen or whatever, is going to affect your microvasculature. It's not all the things that affect it, but it's not good for healing. So chronic use.
Do you have more to say?
No.
Oh, okay.
Okay.
Oh. Yeah. So yes, if it's legal in your country and you are so inclined, we, definitely should clear with your doctor, but edibles are a good suggestion. They can definitely help with pain. All right. Which we're going to talk about now, because guess what, folks? Lipo hurts.
It reminds me of that song, Love Hurts. Love Hurts.
Yep.
It's like Lipo Hurts.
Lipo hurts. Yeah.
Make that commercial. Remember the Gatorade one?
Oh,
where
yes.
the sweat and everything.
Yes.
We could make a lipo hurts
Yes.
with all the black and white.
Yeah.
Yep. Because it does. So let's dig into, and there was actually one, I don't know what they're called, thread, where the person said, y'all didn't tell me lipo recovery is hell. And definitely some of those came from this thread. So mentally prepare yourself that the lipo will hurt, like a lot, so much more than you think. Pain varies between people, but prepare yourself for it to hurt a ridiculous amount. That being said, the results are stunning and worth the pain. Truth.
Ridiculous amount. It seems extreme, but there are some patients that have that feeling, but it definitely hurts.
It's more than people think.
For sure.
And I think that's, and like she said, pain varies. And yes, pain is subjective. I'm never going to tell someone that stuff doesn't hurt, but I think they just think, especially if it's done awake in the office, you're like, oh, this is a nothing thing.
Right, because it's done awake. I'm talking to you.
This can't hurt
besides
me.
the local anesthesia I put in, it doesn't even really feel that bad. And then they complete it, and they're like, wow, that wasn't that bad.
4 hours later, your body is flooded with lava, and you're in ridiculous amounts of pain.
Yeah, ridiculous.
Stunned. But the results are
ridiculous
stunning.
is kind of an overstatement, but what's slightly less than the ridiculous? Crazy?
Yeah. Yeah. This one, it's horrible. 3 exclamation points. I'm almost 3 weeks post-op and the nerve regeneration pain is a whole other level of horrible. I didn't get the massages though, but I feel you. The person had said that they got the massaging really hurt, and like it should not. I mean, lymphatic massage after lipo is fine and it should not hurt. If your lipo is causing you pain, if your massage is causing you pain, that's the wrong kind of massage. But the nerve, we have a whole episode where we talk about nerves, and those nerve sensations can be very sharp.
Mills is going to put it up.
The magic school bus trip in the nervous system. But yeah, when those nerves all start, and I always remind people of this, like your body doesn't know the difference between injury and surgery. And lipo on the inside of you is a whole lot of injury.
Right, that's my comment, which I'm proud of, is when I said it doesn't know the difference between a surgical knife and a samurai sword.
It does not.
A well-honed samurai sword.
But if you think of lipo, and this is what I explain to patients, like think of lipo as like the biggest road rash ever. Like if you have like that thick, if you have an area where you like road rashed up and it's got this like thick scab on it and it itches and it's sore and it takes forever to heal, like that's what's happening inside your body.
Exactly.
Like that is what lipo has done to you.
But it's like all on the
road rashed you
inside. The whole area that was treated is rough and angry like
so
that.
You can't see it, but that's what's happening. So yes, it is a whole other level of pain when those nerves are firing like crazy. This person said, I was in a decent amount of pain for 4 weeks. It peaked about day 10. Some of that is just because you're over it at that point. It's rough. And the surgeons like to downplay how painful it is. What do you say during surgery?
If you suck it up, we'll suck it out.
No.
This doesn't hurt me.
Ding, ding, ding.
Yeah. That's my running joke.
Mm-hmm. This doesn't hurt me.
Don't worry. This doesn't hurt me.
Mm-hmm. Yeah. Like how bad is it? Like not bad. And he'll say to people when they're leaving, like, so how bad was that? Like a 2? And the person says it yes then because they're numb.
I'm putting it into their brain before the pain comes.
Yeah. So yeah, it can though.
Positive affirmations.
Yeah. I tell people like you're going to know you've had lipo in an area for a while. And by a while, I mean like a while. Like this person said like 4 weeks, a decent amount of pain. I mean, pain is subjective, but like you can expect to know that you had something done in this area for some time. Like
months.
Imagine, yes, picture the road rash. See, hear that from the surgeon's mouth. Months.
Yeah.
Yes. I love this one. My mom had the same done as me, and she told me she stopped having pain and feeling normal 3 months.
3 months.
Post-op, but the results will be worth it. right?
I agree.
Absolutely true.
Yeah. Liposuction in our office has a super high satisfaction rate. So people are really pleased, especially when it's done away because they don't have to go to the OR and they can have a big change. But it's a process of recovery.
Yeah.
I mean, many of the patients have thoughts like, wow, okay, I did this, I really, really did this. And
well, they realized it was not the shortcut they were hoping it would be.
Right. I think there was always like a little bit of hope out there. Like
that this is magic
Amy
beans.
and Dr. Martin weren't like really telling the truth.
Yeah.
Like this stuff's
This doesn't
easy.
hurt.
Yeah, this is nothing. And I think about week 2, you're like, okay, this is something.
Yeah, like this was a big deal. Yeah. All right. We're going to take a quick break and we're going to come back and we're going to talk some more about recovery from lipo.
Let's do it.
And we're back. All right. So we're still talking about pain for a little bit longer, but these ones, it gets better. So this person said, every day it gets a little bit better. Be gentle with yourself. If you're going to feel better day by day.
You're right. And that's true. That's true. You might have a couple days where like you do something or maybe you're overactive and your inflammation starts up, but most of the times it's like you get gradually better.
When I tell people that, like the first week is rough, but you'll be shocked. I mean, when I talk to people the day after and tell them this, like by the end of the week, you're going to feel like 1,000 times different. They don't believe me in the moment, but by the end of the week and by the time we see them when they're a week out, like, yes, like it still hurts, but it's not like it was that first day.
Can I read number 6?
Sure.
This person said, same. I was in pain for weeks, which I thought was really funny. The pain from getting out of the cars and up the stairs are still seared into my brain. I mean, that's pretty eloquent.
Well, I warn people about getting in and out of the car because especially if you have lipo on your flanks, like there's no way to avoid like just rubbing your whole low back across that seat.
Ooh, yeah. And then and then seatbelts.
The seatbelts, it's not that, it's the flanks.
Well, the seatbelt on the flanks. I mean, I'm bringing it. Well, no.
Nope. It's getting in and out of the car.
Rubbing the seat.
The seat.
Oh, okay, I got it.
Yes, it's getting because there's no way to not have it touching all of you. Like when you get, you can't like slowly, in most cases, get into a car, and like depending on the type of car, like especially
a Porsche 911 getting into that.
And there have been a few where like I walk a patient out to their car and like their husband drove the sports car, and I'm like,
a McLaren.
That's happened.
I mean, that's like a full-on bucket seat, and there's nothing to grab onto to get out of it.
And you're leaking.
And you're sitting like 4 inches from the ground. So you just
getting
have to
up
get all the way down there.
Well, and getting back up out. I mean, like you need like someone to help you. So
Even with the handles, it's hard to get in a car without sliding in.
Yep.
You
It's
don't
impossible.
Have a handle on the other side of you, so you can't lower yourself really.
I remember when I had back problems, and Amy got me in the car, and just the getting into that car, and I laid down in the back. Do you remember that?
Oh, that is seared in my brain.
Yeah. And I had that feeling like where I was rubbing against stuff and it was hurting. Yeah.
It's nothing like the hospital calling you to come pick up your doctor.
Yeah.
Because he was unable to drive himself.
So it was one of the best stories. So like I had I used to have back pain, and this is before actually both Amy and I really got into weightlifting and strengthening my core. So it made a big difference in my life, by the way. So if someone's suffering with back pain, we both believe that weightlifting and strength training can really help. But anyways, I had this like spasm episode.
While he was seeing a patient.
Actually, I'd already seen the patient.
Yeah.
Thank God.
But you were in her room. You were still in the room.
Nope. I was walking out of the hospital, and my back seized up. If anyone's ever experienced that, like you have to stop. Okay. And I went down on one knee, and just by chance, one of the nurses I know was there. She yells out, "I think he's having a heart attack."
He was in his 30s at this point. He was in his early 30s.
And I'm looking at her. I go, "No, I'm having a back spasm." She goes, "Are you sure it's not your heart?"
You were probably only like 34 when this happened. 34, 35.
Oh, at the most.
Yeah. So they call me, and he's in the ER calls me. So and it was at a hospital that was actually not our main hospital. It was like a half hour away. So like I fly out of the clinic, drive as fast as I can to get to this hospital that's like 40 minutes away. And I run into the ER and there's nobody there. So I literally just like there's nobody there. So I just take off down the hall where I know the patient rooms are. And I'm like looking in every single room. They're empty, empty, empty. I'm like, oh my gosh, like where is he? Did they have to take him to surgery? Like, because they didn't tell me what happened. I didn't know that you just had a back spasm.
Yeah.
They said you were in the ER. And your wife was out of town. I'm like, oh my gosh, how am I going to tell her that he's like...
And basically I said to Amy, just get me the hell out of here.
Yeah. No, so I'm like, you okay? So like I peek in and like I had no idea what had happened. So I didn't know if you were going to be dressed, if you were going to be like dead, like hooked up to an intubator. So I like peek around and you're laying there with your winter coat still on.
Oh,
You hadn't even taken your coat off.
I mean, I know we're belaboring this story, but I adamantly was refusing care because I knew what was going on, and I knew like
They pumped him full of muscle relaxants though.
but they would not take like they wouldn't let me refuse care, which I think is illegal too. And they threw an IV in me and put muscle relaxants in. I have to tell you, pretty type A person, once you get those muscle relaxants in you, life felt pretty good. Pretty good.
How lucky are you? As many people as I know has thrown out their back. No one just had readily available muscle relaxants.
I know.
Was at a hospital.
Yeah, it happened to Sarah not too long ago. For the first time in her life, she was cleaning the oven racks in the bathtub, and then I just hear like the weirdest, and she's just laying there. Oh, I don't know what's happening. I'm like, oh, you threw your back out.
Yeah.
Welcome to the club.
Welcome
It's
to
been
the club.
happening to me for 20
That was the only
years.
time that ever happened, actually.
Yeah,
To me. It
but
was
you're
one
right.
time.
Core strength is a big part of
And
getting through
I
that.
have, that was how many? I mean, 17 years ago now, 18.
At least.
Yeah. And I once I kind of got into better shape and really strengthened my core, I haven't had a single problem with my back, not one time, which I find very interesting. But I do think it's funny that no matter what's happening in a hospital, the minute you go down on one knee, they just assume you're having a heart attack.
Well, you're a man. You're a white man.
There's
You're having a heart attack.
Nothing else that could be in the differential diagnosis.
No.
It's like nothing else.
Well, because anything
You
else.
could maybe you tripped and went on one knee, heart attack.
Well, because anything else you could recover from. If
True.
they don't identify the heart attack, that could actually kill you. Yeah.
All right, sorry.
Yeah. No, that was a fun diversion. All right. So these ones are great. So they're a little more encouraging. You'll be fine. Trust me. I'm currently recovering from it. I had lipo to my hips and the back on the 16th of December. I promise you, recovery is painful to start. In a few weeks, you'll be fine. Yes.
That's true.
It's so true.
Yeah.
Like, this too shall pass. It takes time, but it gets better. And this person said, I'm 3 years post-op, and yeah, it's going to take a few months for everything to settle back down to normal. Follow your surgeon's instructions to the T.
Whoa, I like this person.
It's not a walk in the park procedure as people make it out to be, which is true.
So to the T, what does that come from, that saying? To the T. Is it like the way the T's come together? Someone has to look that up.
It probably stands for something.
Yeah.
Nils is going to look that up while we move on.
Yeah.
So this one, these again, some more, one more. I completely agree. I underestimated the recovery, but looking back almost 4 years later, I am so grateful I did it.
Right. That is,
And like you said, that's the general sentiment.
Yeah.
Yeah.
Liposuction is a really transformative procedure. And like a lot of people who, are focusing on their health and in pretty good weight, they have areas of fat they can't get rid of with diet and exercise.
Well,
This is
that
not
have
going to
like
happen.
tormented them for years.
Right. And they can just, with one procedure, get rid of it.
Let's put the picture. Dr. Martin will send Nils the picture to put here of the saddlebags. This woman is an actual model, a legitimate model, and got rid of those saddlebags.
Yeah. It's crazy.
Yeah. Nothing else wrong with her body. Did you find it?
I did.
All right.
Let's see. Phrase to a T likely comes from the word tittle, Tittle.
Never would have guessed that.
Never
Nils.
would have guessed that, which refers to a small mark like a dot of an I or the cross of a T in writing. So to a T means something is done or fits perfectly. So I guess it's like dotting your I's and crossing your T's.
Yeah. That's
It's kind of where it
Like
comes from.
finality. You
Tittle.
do it
I'm just
perfectly.
going to start
Yeah.
using that normal.
Tittle.
In my
Follow
normal
it to the
lexicon, just tittle. I just
Yeah,
felt a little
weird.
tittly today.
That could be misconstrued.
Is that like weird Reddit?
No, that's not weird Reddit. That's just people are going to think you're a weird doctor.
Just start talking in old timey
Yeah.
terms. Everything.
Old timey terms.
So you say.
Yeah. So I said lipo hurts, but sometimes it doesn't, AKA pain is subjective. And I stand by this. And here are some examples of people who have a different experience. This one said, I mean, everyone's experience is valid, but I was walking around without pain meds the next day. Well, and that's different. I mean,
That's a flex, man. Flex emoji.
Well-
she's like texting all of her friends like this, the biceps emoji. She's like, yeah.
she said she
no
wasn't
pain.
taking pain meds. She didn't say she wasn't in pain.
Walking around without pain.
meds.
Oh, pain meds.
Right.
Okay.
That's why I said without pain meds. Like
Got it.
I had my wisdom teeth taken out and didn't take pain meds. I came right back to work.
So she's just gutting it out.
Well, but that's the point.
Yeah.
Like what one person thinks is ridiculous pain that they're taking pain opioids for 10 days. Another one is like, it was fine. It hurt. I walked around. It was fine.
Right.
So yeah, this one. Hey, Don't be scared because of this! Exclamation point. Some days are worse than others, but generally the pain is only a 3/7 to 10.
Yeah. Another. That's within my range. My Tony Robbins. Look, are you feeling a 2 right now?
Or is
it's going to be a 2 forever.
Yep. A 3 or a 7 to 10. There's a big range there. This person said, I thought it was a breeze, but maybe because I got my liposuction to my upper arms, which, yes.
It's definitely going to be easier for that.
I felt random short-lasting stabs every once in a while for 5 months, which is that nerve pain, but otherwise no pain really. I'm 8 months post-op.
Nice.
And this is so true. Some areas are easier than others. I actually saw a patient today who we did lipo on her abdomen and flanks about a year ago. A week ago, we did her upper back, and she's like, this was nothing. Like, same thing. Didn't even take Tylenol. Yeah. Like, yeah, it was sore the first day, but like, this is nothing. So the area is a big part of it. And something like the arms, because they're so mobile and you don't rest them on things very often, even like in the car, again, getting out of the car, like the back of your arms don't need to touch anything. Like,
so upper back lipo, specifically on that patient, you have to be so aggressive to get the fat out. You have to, on the bra line, you have to be very aggressive with the liposuction. And it's just so surprising that they don't have discomfort after that procedure.
No.
Yeah.
Because it's an area where you can more easily keep it from touching things.
Right.
Yeah. I think that's a big part of it. That's like with the arms. And this next person said the same thing. My arms were so easy. I think it hurt for 2 days. And after that, I was tight and sore for a couple of weeks.
Which is like, it sounds like she's saying like, you guys are crazy. My arms are easy.
Well, no, I mean, that's, you know, these people are all saying that it was tight and sore for a couple of weeks. Nobody's saying it was pain-free.
Right.
Even the people who are saying it wasn't painful aren't saying it was pain-free. My favorite is a 3 or a 7 to 10. 3 to 7 out of 10. Yeah, like all the bases.
It was like a 2 to 9 out of 10.
Right. Yeah.
That's my kind of patient, though.
Yeah. Yeah. Some more of these. I felt it was super easy as well, but only had awake upper arms and submental done. So the chin. I had Vaser. I was basically up and about the same day, obviously with some discomfort. And yeah, you're up and about the same day.
Surprisingly, submental or underneath the chin is actually very well tolerated.
Yeah. Such a tiny area.
You would think it would be hard, but it's not.
No. And I think that the area too, like it's just a little area. So it's a little road rash instead of like, you know, an entire highway of road rash. This person said, I've had 2 rounds of lipo and it wasn't that bad for me. Everyone has their own experiences. I would do it a 3rd time. I love the changes I see.
3's a charm.
Yeah. My downtime was only 2 days. I drove to Panera day 2 and I won't lie, I was definitely sore, but not painful. And that's where the subjectiveness of pain comes in, right? Yeah.
I mean, Panera is a draw though. That'll get you from a, you know, if you're a 6 out of 10, get you in the car probably.
We had a patient, we did her chin and that was what she wanted on the way home. It was so funny. She's like, when I was talking to her the next day, she's like, we stopped at Panera on the way home and she had taken Halcyon. She's like, we got so much food. She's like, I ordered basically everything. She's like, there's so much. She's like, I don't even remember doing it. She's got like this, she's like, I got the soup bowl and like she was telling me all the stuff that she had her husband order.
And of course he's going to do whatever she has. Yeah, because
like,
she's like the patient at that point.
On the way home from surgery.
Totally.
She's like, you were so right. She's like, I'm so glad I didn't online shop. I'm like, yeah, exactly. You would have bought everything.
That's the best part about being a caretaker. You get to eat all the crazy food that the patients
want. All the stuff they ask you to order and don't eat. She's like, I don't think I ate any of it. Yeah. This person said, I got lipo on the legs and flanks and it wasn't painful at all. I walked well right after surgery. It felt like stretched muscles while I was sitting for 1 to 2 weeks, but didn't bother me. After 2 weeks, I was back into pre-op condition.
Nice.
Yeah. And moving around after surgery does help. That's the one thing I tell people, like once you're up moving around after surgery, you're going to feel better. It's when you've been sitting for extended periods of time and then you get up that things are sore, like just kind of, stay mobile.
So the lymphatics follow your blood vessels. If your blood vessels are pumping blood, your lymphatics will drain more, and walking increases that circulation. It all works together.
Yeah.
So walking is one of the best things you can do after surgery, especially liposuction.
Especially lipo. This person said, I got lipo a year ago and recovery wasn't bad at all. I was sore for 6 weeks or so. And see, again, this is where the subjectiveness. Someone who's sore for 6 weeks says it wasn't bad. Another person's like, 10 days, it was terrible. But I only wore my compression for 4 weeks per her plastic surgeon's instructions. Didn't get massages, didn't wear boards or anything like that, and had no lumps, bumps, loose skin, not much swelling. Right?
What?
You mean
they didn't wear a board?
Oh, that trust me.
Is this person a nihilist?
There is a whole other.
What do they think they're doing?
Yeah, crazy world of people.
We've had an episode where we the myths of liposuction. Just Nils, put that up here. Where do we talk about that?
Yeah, because we talk a lot about compression, and there's so much out there. People are like, oh my gosh, if you don't wear a faja for 12 weeks after surgery.
I'm not even sure what a faja is.
It's just a binder.
Okay.
It's a Brazilian name for a binder. It would be saying like wearing a waist trainer.
That feels extra, but is a faja something that people wear normally, not with?
Yeah, that's what I mean. It's a waist trainer.
Oh,
yeah. It's not meant for lipo. It's a waist trainer.
Got it.
It's a corset.
Never mind.
Yes.
Okay.
Like you should not wear that after lipo.
Girdle?
Yes.
It's
like a very tight, like a waist trainer, like what a competitor
like what a
would wear.
Kardashian would wear.
Yes.
Okay.
Yes.
Interesting.
Yeah. So that's all I've got, Dr. Barton. So in summary, be prepared. Lipo hurts, but sometimes it doesn't.
Right.
And you will absolutely not regret it.
Your pain will be between a 2 and a 10.
Right? Somewhere between a 3 and a 7 out of 10.
And if you ever go on one knee in a hospital, they will assess your heart.
They're going to think you're having a heart attack. I thought these were great. I mean, this is, if you know the right answer, then you can definitely find some great stuff on Reddit.
Right.
Now, you could granted read these things and be terrified. And trust me, you could read horrific things and people talking about the horrific experiences they've had. But that's not the reality of what we see.
Right.
And we've been at this for a long time.
A long time, way too long.
Yeah, we've done a lot of lipo of all
since
kinds.
My heart attack, my first year of practice. So for sure, liposuction is an awesome procedure, as we said before. If you have small pockets of fat you don't like, liposuction is a great way to take care of it.
Throw that fat in the trash.
If you have large pockets of fat that are just resistant to diet and exercise, liposuction is a great way to take care of it. If you are of normal weight or slightly overweight, but you're healthy and you have an area of fat that you just want to get rid of, liposuction is a great option. We use devices to help liposuction work better, like Body Tight. We talked about Vaser in here. Those things tighten skin and melt fat at the same time. We do most of our procedures awake. You can do it in the operating room. And it's one of the most common procedures that are done by board-certified plastic surgeons, which is something we didn't talk about today.
Well, that's because this is a Reddit episode, not an everything you need to know about surgery
But the rub
episode.
of the surgery basically is it's not comfortable. I mean, it's one of the more, not difficult recoveries, but one of the more involved recoveries of any of the surgeries we do.
I wouldn't say it's involved. I would just say it's long. It's longer than people think
Long.
for what, because there are no incisions and they don't have, sometimes stitches. So they think they shouldn't need recovery time.
Yeah.
So it's the perception of the recovery that seems long because there's not an external wound.
Thank you. It's the psychology of it, because you have a small stab incision or a small little teeny incision and you think, oh, I should just be healed. But there's a lot of healing going on underneath. And the process of healing is really important to support yourself nutritionally, mentally, walking, recovery station, everything that we talked about here. So I thought this was an excellent episode. And actually, I think if you were going to do liposuctions, it'd be a good episode to actually watch.
Yeah, I agree.
Yeah.
Yeah.
Other than the entertaining comments.
Yeah.
Yeah.
All right. Well, so until next time.
Don't you want to do whatever we do?
That's what I was saying. You can find all of our social media handles here. And also, if you would like to be on an episode of Beauty and the Surgeon, you can definitely leave me a comment or a question.
You could fly to Denver and join us.
Nope. 303-630-9038. And we will see you all here.
Or you could call us. I'm sorry.
Next time.
See you later.